Welcome back, folks. Two major announcements from Buckingham Palace today as members of the royal family deal with medical issues. The palace confirms that the Princess of Wales, Kate Middleton, is in the hospital recovering from abdominal surgery tonight. And next week, the family monarch, King Charles, will undergo a procedure as he seeks treatment for an enlarged prostate. So let's begin with details on Princess Kate's recovery. Buckingham Palace says she was admitted to the London clinic yesterday for a planned abdominal surgery. She's expected to spend the next 2 weeks in the hospital recovering and will not resume her public duties until Easter. King Charles, meanwhile, will be admitted to the hospital next week for what the palace calls a, quote, corrective procedure on his enlarged prostate. The palace says his condition is benign and that his public engagements will be postponed for a short time. King Charles chose to make a public announcement about seeking treatment for his enlarged prostate in order to encourage other men to do the same. And data shows that awareness and intervention saves lives. According to the American Cancer Society, 1 in every 8 men will be diagnosed with prostate cancer in his lifetime. It is the second leading cause of cancer and cancer death among men, but if caught and treated, the 5-year survival rate is high, 97%. Joining me live tonight is Scripps News medical. Joining me live on Scripps News tonight is medical contributor Dr. Omer Awan. Dr. Awan, Buckingham Palace has framed this announcement as a way to raise awareness. The statement stresses that the king's condition is common in thousands of men in the UK each year. Survival rates are high if treated, and yet this is the second leading cancer death in men. What's the disconnect here?
Well, it's exceptionally common. Prostate issues are very common in the general population. More than 1 in 8 men will eventually get prostate cancer sometime in their life. And having an enlarged prostate gland, which is separate than prostate cancer, is also extremely common. So 50% of men between ages of 50 and 60 will get an enlarged prostate gland, and that increases as you age. So definitely the vast majority of men will experience some issues with either an enlarged prostate gland or prostate cancer at some point in their life. So very important for us to understand what this is, what the symptoms are, and if necessary, get screened for prostate cancer.
Yeah, let's focus on prostate cancer here. What are the characteristics of this type of cancer when it comes to how it spreads, and what are the challenges in getting a diagnosis?
Well, I think the challenges are there's no universal screening for prostate cancer. And why I say that is because the United States Preventive Service Task Force has not recommended universal screening. They do recommend that men between ages of 55 and 69 have a conversation with their physician and to weigh the benefits and risks to see if you should get screened. So that's very different than, getting screened for colorectal cancer or for females, breast cancer, females for cervical cancer. A lot different. But with that said, I think, certainly if you're high risk, if you're African American, if you're Black American, if you have a family history of prostate cancer, if you are obese, you should definitely consider getting screened because it's so common and definitely something that, if treated early, can really be prevented to having, downstream negative health effects.
Prostate cancer has been in the headlines recently following news of Defense Secretary Lloyd Austin's diagnosis and treatment. There's been a lot of justifiable attention on the circumstances and questions about why he didn't speak up sooner. But I want to put the focus on the context here. Black men, as you said, are significantly higher risk of prostate cancer than their white counterparts. According to data we found, they are 1.7 times more likely to be diagnosed and 2.1 times more likely to die from prostate cancer. What exactly is driving that, doctor?
Well, it's a complicated answer, Christian, to be honest with you. I mean, I think there's a lot of factors here, one of which is that there is some genetics. So, it's very well known that prostate cancer is associated with androgens, which are male hormones. And we know that Black Americans have higher levels of androgens in their blood. So that could link them potentially to have a higher risk of getting prostate cancer. But I think part of it is also socioeconomic issues, things like, Black Americans disproportionately are part of, low income communities, low resource communities where they may not have access to getting screen, getting appropriate diagnosis, getting appropriate therapies. And of course, we should not forget racial bias and implicit bias in medicine. Many studies have shown that physicians may be reluctant to offer screens to Black Americans. And this is very concerning. We as physicians have to do a better job, decreasing implicit bias and racial bias when we interact with patients.
Dr. Awan, with the last 30 seconds we have left, and it's not fair to do this to you, but I'm curious to know more about the stigmas surrounding prostate cancer. What are those stigmas? What can we do to remove the stigmas around this with the last little bit of time we have left?
Well, there's so much stigma. First of all, when you get diagnosed with a cancer, we have this feelings of anxiety, depression, but also there's a specific stigma of decreased and diminished masculinity, especially associated with prostate cancer. And that relates to many of the therapies that result in decreased sexual function, in some cases, impotence, in some cases, erectile dysfunction. Many men are scared of that, and many men don't want to get treated or screened because they're scared of this sexual dysfunction. So we have to do a better job to destigmatize this, talk about this, make this more normal to talk about prostate cancer and being screened and the benefits of this. And I think will hopefully decrease the stigma that's so important here in public health.
Scripps News Tonight, medical contributor Dr. Omer Awan. Doctor, many thanks. We appreciate it.
Absolutely. Thanks for having me, Christian.